Welcome to Health Watch, presented by Novant Health. I'm your host, June Baker. We have a special show planned for you today. I'm standing here in front of Oceanside Family Medicine and Convenient Care, one of the newest medical offices in Brunswick County. We'll have the opportunity to tour the office. We're going to learn a little bit more about the services offered here, and we'll meet the providers. Stay tuned for your sneak peek into Oceanside Family Medicine and Convenient Care. I'm so excited to be here today, and I'm really looking forward to this tour with you, Dr. Eisenhower and Dr. Thompson. So how about let's get started?
Sure. Okay.
Well, let's talk about this. This is what, the waiting area?
This is our waiting area. This is Oceanside Family Medicine and Convenient Care. It's a big upgrade over where we came from. Mm-hmm. Before we had about 16 seats in our waiting area.
Really?
People were pretty cramped.
Are you serious?
Here we have 52 chairs.
Wow.
And a couple of other waiting areas in the back.
Really, really.
Mm-hmm.
And I noticed there are 3 windows. And could you talk to me a little bit about that? Why are there 3 separate windows?
We actually have 2 practices working out of this location.
I see.
And our practice has 4 providers at this time, so we have 2 windows just to ease patients checking in. So there's plenty of options for trying to get appointments in quickly. Mm-hmm. And on this wall, we have another practice. Brunswick Pulmonary and Internal Medicine, which is Dr. Ravi. I don't know if you know Dr. Ravi.
Right, I have heard of Dr. Ravi.
So her check-in window is over there.
I see. Okay, well, it's beautiful. It's a bright, and I love all the windows. It's a great space. So how about let's go inside and look around?
Sure.
Okay. All right, now what happens in this area right here?
Well, this is our check-in area. We have 2 of these, one on either side.
I see.
And pretty much the building's just a big square,
okay.
So it's pretty easy for patients to maneuver.
Uh-huh. So this is just a check-in area, another check-in area.
Yes.
Mm-hmm.
Okay, well, let's go on down the hall and see what's next. Well, I see that we're in another waiting area. Mm-hmm. This one's it's lovely. It's decorated so pretty, and I love the colors. And so who waits here? Is this like a second stop?
Well, this is our lab and x-ray waiting area. So patients who have seen a physician and then are waiting for labs or x-ray, or sometimes we have patients that are just coming in that day for lab or x-rays, can wait here.
I see.
And it helps with congestion out there. It also gets
Sure.
people that are well away from sick people in our lobby.
Great idea. That's a great idea. Well, since you mentioned lab and x-ray, let's have a look at those spots. How about the lab first?
Okay. All right, this is our lab area.
Wow.
And it's a bit more spacious than our old one. We have 2 lab draw areas.
Mm-hmm. Do you have a phlebotomist
2.
all the time? 2?
2, and we actually contract that out to LabCorp.
Mm-hmm. So they're here every day?
Yes.
Oh, well, that's very convenient for your patients then.
I think so.
The patients love it.
I bet they do.
They love the convenience of not having to travel to get the things that they need. And
that's
so that's kind of what
kind
our
of
whole
one-stop
philosophy
shop.
is about, right?
Yeah.
To be able to do as much here on the premises as we can.
Great idea.
Yes.
Okay. All right. Well, let's move over to the x-ray area.
Sure.
Okay. Okay, so this is x-ray, right?
Yes.
It's beautiful. It's all new. You have all new equipment.
Yes.
It's great. So do you pretty much do all kinds of x-rays here?
Yes, pretty much all x-rays, joints and
Just your typical
abdomen. Yeah, just the typical
standards.
x-ray, standard x-rays. And we have several x-ray technicians here on staff.
You do?
Yes, ma'am. And they're here.
I didn't know that.
Yes, they're here during the day, and we can, as far as x-rays, we can provide the same services that we provide, that are provided like at the hospital, with regard to being able to give the patients a copy of their study to take to a specialist office if they should need to do that.
Wow, that's awesome.
Yes, and we can actually have the capability to look at the x-rays ourselves to make sure that there's no acute things that need to be handled right away. So this is one of our favorite things that we've
I bet it is. I'm curious, did you have x-ray in your previous
No, we didn't. And it makes it a lot easier to treat people, especially walk-in patients that have acute injuries. In our after-hours clinic and our weekend clinics, it's nice to be able to have information that we wouldn't otherwise have to tell a patient, whether their ankle is broken or not, or will a brace suffice, etc.
I'm just amazed at this. I think this is a great thing for Brunswick County and for the patients that you have here.
We agree.
Good. Okay, well, let's move on to the next area. Hey, Dr. Eisenhower, you mentioned after-hours clinic, and could you talk to me a little bit about that? What actually is that?
Well, we see patients here 8 o'clock in the morning until 8 o'clock at night.
Okay.
And as family medicine providers, we want to be available to our patients as much as they need us, as we can be. And that 8 to 5 day isn't always long enough.
That's right.
Sometimes 8 to 5 we're scheduled out with patients, and we have other patients that need to see us for minor things or sometimes even major things.
Yeah.
And we wanted to provide some extra time in the day that we could take care of their needs. And we also have hours on weekends because all patients also have needs and concerns on weekends that they want to have addressed.
So that's the convenient care part? Is that your Oceanside Family Medicine and convenient care? And so is that the convenient care piece?
That's the convenient care piece. And we think of more of it as an extension of hours of our family practice. It's not really there's no real difference in what we do or perform. We're family docs 24/7.
More hours of it, right? I know when my children were small, when did they get sick? At night and on the weekends or a holiday. So I think that's a great plus for this area, and I'm sure you'll be real successful with that.
The other good thing about the convenient care is the fact that not only do we service our patients during those hours, but anyone in the community is welcome to come. This is a tourist area, so we have a lot of visitors to our area, and those patients are welcome to come as well instead of having to go to the emergency department. So
it's much more cost effective for them to come to your area. And then I imagine that you would forward those records to their primary care physician, and so there would be a continuity there?
Absolutely.
Great. Well, that's awesome. I love that concept. Well, okay, what's next? What can we see next?
Ultrasound, right?
Great. That sounds great. Okay, so this looks interesting, but I'm not sure what it is. What does this do?
Well, this actually is an ultrasound machine.
Okay.
And that is one of the other pluses that we have here at Oceanside Family Medicine and Convenient Care. Is one of the conveniences is that we are able to actually do on-site ultrasounds, and that also is a plus. And we really have found more and more that the patients just love, once again, being able to have as much of their care rendered by their doctors in their home, in their medical home. So ultrasound is one of the things that we can do. I mean, we can, check.
What do you do with an ultrasound? What does that look at?
It looks at mostly internal organs, but also vascular studies we can do. It looks at the heart. If you do an echocardiogram, which would look at your heart, you can check for blood clots, cholesterol plaques. I mean, multiple things that ultrasounds can do.
And most of those things in the past, you would probably have had to go to an outpatient center at the hospital or something like that. But now you can do it in your medical home.
Exactly. Exactly.
Wow, that's a great plus for this area.
It is.
Yeah. Okay. Okay, you ready to move on?
Yes.
I'm excited to see the rest.
Okay.
Well, that was very interesting. But I noticed you have a lot of doors and a lot of rooms. How many rooms do you have?
We have 21 exam rooms here, and then plus we have the ultrasound room that you just saw.
Wow, that's a big increase, isn't it, from the size of your...
In our old building, we had 9 for our clinic. Now, that's not including the rooms on the other side for Dr. Ravi. She has another 3 rooms.
Wow. A lot of rooms. So we'll have to take a look at some of those because the colors are beautiful. And I'm curious, who did your decorating?
Well, the partners, we helped pick out colors, and my 10-year-old and my 6-year-old kids made sure that they fell in line with their taste.
I see. So it was kind of a family affair, being your business family as well as your personal family.
That's right.
Well, that's good. That's good.
Yes.
Everybody's got.
Dr. Eisenhower did spearhead the,
Did he?
but he did ask our opinion, and we did pick out everything together. But he did the majority of the.
Well, the
the
artwork is
decorating.
amazing.
Yeah.
There's tons of swatches over our bed at home, and our kids were like, "This one doesn't work."
Right. Well, I love all the artwork. There's so many pieces in here I would love to have in my home. So you've done a great job.
Well, thank you.
I think everybody will be really pleased and real happy here. It's a cheery, bright atmosphere.
Exactly.
And I think it lends itself to wellness.
Yes, it does.
Okay, well, let's go on and look in some of the rooms. And now this is the nursing station or
Yes.
a documentation area.
This is the area where the nurses do the majority of their work, and the best part that we found about this setup is the fact that the nurses are easily accessible to us. So, there's never a time when we come out that we need a nurse that we can't find someone because they're right here, and that's a plus when you're doing the busy medical thing. You have to always be mindful of time, and every moment that you can conserve is best for us and for our patients. So that convenience of having the staff right there at your right at your fingertips. Exactly.
Yeah, that's great.
It's real easy to see who you want to see and get someone to help you, but it's also nice not to be rubbing elbows with people when you walk down the hall in our other location. We just didn't have a lot of space.
Right.
And here we have tall ceilings and windows shining light in. It's less depressing to come to work because we have natural light and good colors.
I noticed that you have a lot of natural light. You've utilized high windows so that you don't have a lot of window coverings. And I think that makes everyone feel much better. I know I require an inordinate amount of sunlight, and so I think that's a real plus for this area. So I see we have some folks here working. How about introducing me to these folks?
Okay, Jean, this is Marie Wheatley. Marie's a nurse practitioner that's been working with us for 6 years now. She's from Columbus County originally.
Well, hi, Marie. How are you?
It's good to see you this evening.
Good to see you. How do you like the new digs?
I love it. The space and the design that Dr. Eisenhower came up with is very calming, I think, to us and our patients. Very quiet, and the workflow is so much more efficient and I think nicer for us as employees and the patients as well.
Yeah, I think it's beautiful, and I bet you are happy working here. I love the colors.
I do too. They're beautiful.
Well, I would love to spend some time with you in a little bit and get to know you a little bit better. So that'd be good for you?
Yes, ma'am. Thank you.
Okay, great. We'll see you in a minute.
June, this is Dr. Fritz.
Hi, nice to meet you.
Very nice to meet you, Dr. Fritz. How do you like it here?
Well, I think it's sweet. It's warm, comfortable. It's not artificial, stark,
Right.
no hard lines. I think the people enjoy coming here and feel comfortable here.
Well, I really would like to talk to you a little bit more about what you do here at Oceanside Family Medicine and Convenient Care. So would that be okay for you if we sit down for a little bit?
Sure, no problem.
Great.
Hope to see you soon.
We'll see you in a few minutes.
Okay.
Wow, what a beautiful, bright room.
Well, thank you.
What is this room? This big chair.
This is our procedure room.
Uh-huh.
This is where we do minor skin surgeries, laceration repairs, drain abscesses, skin cancers.
That's awesome. Yeah. I guess that's why you have the bright light and all that to...
Bright light, a chair that moves into 1,000 different positions.
Yeah, and it's a much bigger room, too, than the other ones.
We use this room, too, for stretchers. We have people that come from nursing homes or from home that can't get up in a wheelchair or stand. So since it's larger, it's easier to get a stretcher here.
I see. Okay. Well, great. Okay. Thank you. Okay. Well, thanks for the tour, guys. It's a beautiful place.
Thank you.
And now I really would like to sit down with each of you and learn a little bit more about your practice and where you've gone to school and things like that.
Sure.
So thanks again.
All right.